Welcome to this explainer. Let's jump right in, because today we are tackling a topic that frankly carries a lot of historical baggage, but is actually full of absolutely incredible positive breakthroughs. We're going to completely dismantle the common anxieties surrounding spine care by looking at exactly what has changed in the last decade.
But first, I want you to just pause for a second. What picture immediately pops into your head when you hear the words spine surgery? We've got to acknowledge the elephant in the room here. For most of us, that phrase instantly induces a deep sense of dread, right? You picture a major, massive life disruption, and honestly, it makes total sense why you'd feel that way.
Because these outdated fears still completely dominate public perception. You're probably picturing large, painful incisions, spending several days totally stuck in a hospital bed, a really heavy reliance on strong pain medication, and a grueling recovery timeline that's measured in months, not days. And let's be real, this terrifying mental image is exactly why so many people just avoid seeking the care they desperately need. They think the cure is actually going to be worse than the disease.
Section 1. The paradigm shift from traditional to modern realities.
Okay, let's dive into this, because modern medicine has fundamentally rewritten that narrative. We are right in the middle of a massive paradigm shift. Historically, surgeons needed broad exposure just to see what they were doing. They had to disrupt perfectly healthy muscle and tissue simply to physically reach the spine. The surgery fixed the spine, sure, but then you had to heal from the massive exposure required just to get there. Now the modern reality is all about targeted, minimally invasive pathways. We are accomplishing the exact same surgical fixes, like decompressing a nerve or stabilizing a disc, but with vastly less collateral damage to your healthy tissue.
To really wrap our heads around the impact of this shift, we have to talk numbers. There's this fascinating statistic from a 2020 study by Wilson and colleagues. Over a 10-year period, the share of certain cervical spine fusion patients who had 2 or more medical comorbidities, meaning they were older or had other significant health issues, jumped from 30% to 48%. Basically, patients coming in for surgery are demonstrably more medically complex today than they used to be.
And yet complication rates declined. That is the absolute punchline of the last decade of spine care. Even though patients undergoing these procedures are older and have way more medical challenges today, inpatient spine surgery has actually become measurably safer.
And we can confidently back that up with hard data. Studies from researchers like Wilson and Pellice show clear, measurable safety improvements across the board. We're talking lower overall complication rates in major surgery categories, like common neck and lumbar fusions. Even in incredibly complex cases, like adult spinal deformity, major complications and reoperation rates were literally halved over the studied decade. The safety profile is just night and day from what it used to be.
Section 2. Smaller pathways, less disruption, the evolution of minimally invasive surgery. So how exactly did it become so much safer? Well, the first major pillar of this change is how surgeons physically approach the spine today. They're leaning heavily into minimally invasive spine surgery, or MIS. This means using smaller, targeted pathways, specific tools like tubular retractors, and advanced high-definition visualization to treat the spine. The absolutely crucial point to remember here is that the spinal problem being fixed is exactly the same as an open surgery. But what you actually have to heal from afterward is drastically reduced because all that surrounding healthy muscle is preserved. And the practical, real-world benefits of this are striking. When we look at large-scale studies by Picorni and Mooney that compare MIS to traditional open surgery, the improvements are undeniable. Because there's less collateral tissue damage, patients experience significantly shorter hospital stays, way less blood loss, and much lower complication rates. In your day-to-day life, this means you're walking sooner, you're sleeping in your own bed sooner, and you're getting back to your family with far less downtime.
Section 3. Precision through robotic guidance, technology in the operating room.
Now, working through those tiny, minimally invasive corridors requires an entirely new level of precision. To demystify how this is done, let's walk through a system like the Mazor X platform. It's not science fiction at all, it's just a highly structured tool. Step 1. Before the surgery even starts, advanced imaging maps out your unique, individual anatomy. It's like a high-tech blueprint. Step 2. Using that map, the surgeon carefully plans the absolute safest trajectory for any hardware. Step 3. During the procedure, the robotic arm simply helps align the instruments perfectly to match the surgeon's exact preoperative plan. It basically takes the guesswork out of navigating incredibly narrow spaces.
But I want to pause and anchor this with a very, very reassuring point. The robot does not replace the surgeon. Technology is an amazing tool, sure,
But human expertise, fellowship-level training, and clinical judgment make all the critical decisions. The robot is literally just there to help the human hand execute the plan flawlessly.
Section 4. Rethinking pain and recovery. Life after the operation.
Let's shift our focus completely out of the operating room and into what really matters most to you, life after the operation. Because recovery protocols have evolved just as much as the surgical tools. Today we have enhanced recovery after surgery, or ERAS protocols. This is a massive departure from the old days where you just laid in a hospital bed heavily medicated. ERAS is a comprehensive approach. It combines optimized anesthesia, non-opioid pain strategies, and early mobilization to drastically reduce the physical stress of surgery on your body. And the proof is right there in the data. A massive 2024 study by Mazor analyzed over 15,000 patients and definitively proved that these modern recovery pathways yield vastly superior experiences. Patients on ERAS protocols have fewer complications, shorter hospital stays, significantly lower opioid use, and faster ambulation, which is really just the medical term for getting up and walking around much quicker.
This actually ties directly into a really important conversation, the opioid story. Historically, inpatient spine surgery was strongly associated with a high reliance on heavy opioids, but a recent national database study by Schultz highlighted a massive shift. Today, outpatient spine surgery, where properly selected patients go home the exact same day, is associated with significantly lower odds of new, persistent opioid use. Modern spine care takes your pain very seriously, for sure, but the goal is to be incredibly opioid-sparing whenever medically appropriate.
Section 5. Judgment still matters most. Why patient selection is the ultimate tool.
So, we've talked about all this amazing technology, the smaller incisions, the better recovery protocols, but balancing the excitement of new tech with the reality of clinical medicine is vital. At the end of the day, human judgment still matters most. I want to be super clear here. Minimally invasive pathways and same-day outpatient surgeries are incredible, but they just aren't right for everyone. Open surgery is not a step backward when it's medically necessary. If you have a complex spinal deformity, if you need a multi-level reconstruction, have severe revision anatomy from past surgeries, or if you're dealing with trauma, tumors, infections, or a high-risk medical profile, an open or inpatient approach is absolutely the right clinical decision.
Which brings us perfectly to the core takeaway of our entire explainer. Modern spine surgery has changed. The goal is not the smallest incision, it is the right operation performed in the least disruptive, effective way for the right patient. You can have the best robot and the smallest surgical tubes in the entire world, but if the surgeon doesn't perform the exact right operation for your specific anatomy, none of it matters. Personalized, human judgment is everything.
So I'm going to leave you with this to think about. What are your personal goals for recovery? Is it getting back to golfing, gardening, playing with your kids, or maybe just sleeping through the night without pain? Spine surgery has fundamentally changed for the better. Please don't let an outdated fear dictate your choices. Take your imaging, take your specific life goals, and go have a consultation to find out what modern options are actually available for you. Thanks so much for learning with us today.